Okay, I think we'll get started. Can everyone see the slides okay?
Yes.
Amazing, thank you. So welcome to the Maternity Consortium's webinar, Sharing Learning from the Starting Well Fund on Co-Producing Maternity and Early Years Support. I'm Celeste, I'm the Maternity Consortium Coordinator and Engagement Lead at the SANS and Tommy's Policy Unit, and really pleased to see so many people on the call today. Please do introduce yourself in the chat, where you're coming from, if you've had any snow today. I'm in Hertfordshire and we had about 2 minutes of snow and that's it. So it was quite disappointing over here. So if anyone has had any, I would be very interested in hearing about it. In terms of housekeeping, if I could ask that if you're not presenting, if you stay on mute, just so we don't have any background noise, that would be great. And just to flag that the recording of the webinar and the slides will be circulated once the webinar is over. So yeah, we'll get started with a kind of overview of the Maternity Consortium. So the Maternity Consortium is part of the VCSE Health and Wellbeing Alliance, which is a partnership between the voluntary sector, the Department of Health and Social Care and NHS England. It includes a number of partnerships and consortiums focused on a range of different health and social care issues, and Tommy's and SANS co-lead the Maternity Consortium, which includes National Maternity Voices, the Pregnancy and Baby Charities Network, and a number of community organisations such as 5 Times More, the Muslim Women's Network UK, and LGBT Mummies. The aims of the Health and Wellbeing Alliance are to promote equality and reduce health inequalities, to facilitate integrated working between the voluntary and statutory sectors, to facilitate collaboration and co-production, and to ensure the needs and interests of the communities we represent are considered and addressed. So as part of this, we're working to 3 main outcomes. So improved access to services and support for those that experience barriers, supporting providers and policymakers to embed inclusion in service design and improvement, and improved inclusivity and co-design across the Health and Wellbeing Alliance as well. So as part of this, the Maternity Consortium's aim is to reduce health inequalities for families throughout the pregnancy journey, and we will do this by working with policymakers, seeking out the voices of women, birthing people and families, using services and relaying that to policymakers, and co-producing solutions with them as well. So some of the work that the Maternity Consortium has been doing is sharing learning from the Starting Well Fund. So that's why we're here today on this webinar, and the Department of Health will speak in a bit more detail about the Starting Well Fund in just a moment. But we are also doing some work around understanding barriers to accessing maternity care for those at risk of poor outcomes. And from April, we'll be doing some work around ensuring equitable access to specialist perinatal mental health community services and maternal mental health hubs as well. And also doing a project on addressing inequity in neonatal care. So if anyone is interested in the Maternity Consortium's work or any of the projects I've just mentioned, please do email me and get in touch. Happy to speak to people about it. And I'll pop my email in the chat once I've stopped sharing my screen. But on to the rest of the webinar. So really pleased to have everyone on the agenda here today. We've got the Department of Health and Social Care, who will give an overview of the Starting Well Fund. We've got CPSL Mind and the Lantern Initiative on co-producing a perinatal mental health service. We've got Lancashire Women on working with local NHS services in the co-production of referral pathways and peer support offers as well. And we've got Leicester Mamas talking about Starting Well Leicester. And then finally, we'll have a Q&A panel with all the speakers as well. So I'm now going to hand over to Emily and Dee from the Department of Health and Social Care, who are going to provide an overview of the Starting Well Fund.
Thanks, Celeste. I think Rosie is going to share our slides for us. Perfect. Thanks, Rosie. I think Dee, you're starting.
I am indeed, thank you. Welcome everybody. Some of you will know me through our relationship with managing the Starting Well Fund, but for those of you who don't, my name is Dee Diller-Stone and I support the Health and Wellbeing Programme from the Department of Health side, along with system partners in the NHS. And my responsibility also sits with social prescribing as policy lead in the Department of Health and Social Care as well. So some parities there with some of the work that we do. So just a bit of background about the Health and Wellbeing Fund. It started alongside the Health and Wellbeing Alliance programme, and the work on the first fund started in 2017, although the first fund itself didn't start until 2018. It provides grants to the BCSE sector working in local communities, so it's slightly different to the Alliance in that the Alliance is made up of national organisations and consortia. The funds are for local and very sort of groups that may be just not as large and may work on a much smaller footprint. So the overarching aims, the fund supports between 13 to 23 projects a year. Funding levels do vary and they're dependent on departmental budget setting, and that changes over the years, but we aim to have funds that last for 3 years. Some funds have match funding from statutory organisations for years 2 and 3. Some run without any match funding. And as with the Health and Wellbeing Alliance, the funds are supported by system partners with policy leads. Each year focus on a specific theme, and those themes are ones that are important to the sector, both NHS England and also Department of Health and Social Care. So these have been quite wide-ranging. Just to give you an example, in 2018-19, the fund was provided for schemes that reduce health inequalities within the social prescribing sphere. In 1920, it was for children and young people's mental health services, and that was to expand successful innovation in community support for children. And that's due to finish the end of this March. In 2021, we had Starting Well, which some of you will know well. And that was to improve health outcomes for children from preconception to 2.5 years. And the focus of that was specifically on people from a BME background and or areas of high deprivation. And there are 19 projects within that. In 21-22, because of the COVID outbreak, we decided to run a 1-year project, and that was to support respiratory illness within children and babies. That's due to finish at the end of this March as well, and 13 projects were funded for that. So grant funding is generally for 3 years, as I've said. Due to the exceptional changes with COVID, it was just 1 year for the last fund, and we're finalising the applications for round 5. The focus for round 5 will be different again. It is based around work and health, and it's developed with colleagues in the Department of Work and Pensions. And the fund supports projects that focus on women's reproductive health in the workplace. And that includes things like endometriosis and menopause. And it's about retaining the workforce of women and supporting women back into work who have left because of issues with reproductive health issues. So that's the fund. Over to you, Emily.
Thanks, Dee. I'll start with introducing myself as well. So, hi everyone, I'm Emily Barnes. I also work at the Department for Health and Social Care, and I lead in the maternity team. So I lead it on maternity and neonatal, so I'm a policy advisor. So my presentation goes into a little bit more detail about the Health and Wellbeing Fund Starting Well. So in January 2021, the Department of Health and Social Care launched a new £7.6 million fund on health and wellbeing, so the Health and Wellbeing Fund based on the theme Starting Well. The fund supports 19 projects to reduce health disparities among new mothers and babies from ethnic minority backgrounds and deprived areas. So if we go to the next slide, you can see from this map all of the 19 organisations that we have funded and that they're across England. And some of the projects focus on supporting mothers who are asylum seekers, victims of trafficking, expectant fathers, ethnic minority women with mental health difficulties, the Pakistani community, the Muslim women, and high deprived communities. So the projects aim to promote nutrition, learning, language development, mental health during pregnancy and post-birth. And the government is particularly passionate about tackling health disparities in experience and outcome. And these projects support the government's pledge to level up communities and reduce health disparities. So if we just move on to the next slide. So in addition to the work that we're doing around health disparities, the Parliamentary Undersecretary of State, Minister for Patient Safety and Primary Care, recently announced on the 23rd of February, plans to establish a maternity disparities task force to tackle disparities for mothers and babies and reduce maternal and neonatal deaths. So the aim of the task force is to tackle disparities by improving access to preconception care and maternity care for women from ethnic minorities and those living in the most deprived areas. So the first task force meeting took place on the 8th of March, and the meeting brought together experts from across the health system, other government departments, and the voluntary sector to address disparities in maternal and neonatal outcomes. So we want to make sure that the task force is listening to women and organisations in the community regarding how to tackle maternal disparities. So we hope in future meetings that we will invite projects, a part of the Health and Wellbeing Fund, to join and to sort of share their experiences and how we can tackle disparities going forward. And then I'd just like to finish by thanking sort of Starting Well projects for the work they've been doing in the community and providing vital support to families and reducing disparities among new mothers and babies. That's everything from me. Thank you.
Thank you so much, Emily and Dee. Really, really helpful overview. Unfortunately, Emily and Dee aren't able to stay for the Q&A panel, but if you do have any questions for them, please pop them in the chat and we will pass them on to them. But yeah, thank you so much again, Emily and Dee, for that presentation. I'm now really pleased to hand over to Kate, Sephora, and Mumtaz from CPSL Mind and the Lantern Initiative for their presentation. If you have any questions for them to ask in the Q&A panel, please put those in the chat and we'll collate them for the session at the end. Thanks.
Good afternoon, everybody, and I'm just going to share my slides. Can everybody see that? Okay.
Yeah, we can see it.
Okay, brilliant. So yeah, just to introduce, we are a partnership project with the Starting Well programme, and I'm from CPSL Mind, that's Cambridgeshire, Peterborough, South Lincolnshire Mind, and my colleague Sephora, who's going to be talking in a minute, is from the Lantern Initiative, and we're here with Mumtaz as well, one of our project workers, to talk about the service that we're providing for Muslim women in Peterborough. So we secured funding to design and deliver a new service focusing on the wellbeing needs of pregnant women and new mums from our local community, and it's the perinatal period, as you well know. So Sephora, did you just want to say a little bit about the Lantern Initiative?
Thank you, Kate. Yeah, so the Lantern Initiative has been going for about 6 years, and as it says, we are a grassroots community organisation, mainly working with Muslims in Peterborough and surrounding areas. And one of the ways in which we educate and raise awareness of mental health issues is by providing more platforms for the Muslim community to talk about mental health more openly, and thereby reducing some of the stigma around it.
Thank you, Sephora. And so at the Local Mind, we are the Local Mind that operates services in the community. We deliver things, wellbeing work, our Good Life cafes, and we have a crisis support service, our Sanctuary, that works closely with first response colleagues in NHS. We have a kind of IAP service, we have training. So as a Local Mind, we do lots and lots of different things, one of which is our perinatal service in the community, which is available to all. But as you're going to see, we noticed that that wasn't being accessed by the diversity of our community, and so we wanted to work in partnership with the Lantern Initiative to almost bring together our superpowers, is what we say. So we knew that we had a strong programme to offer mums in the community, but we knew that we also didn't have the connections with that community at grassroots level, which is where we recognise the importance of working with somebody like the Lantern Initiative, who are so recognised in Peterborough for mental health. So that's kind of, I think, that the value of partnership working, of that equality, of listening to each other, of being able to ask the questions that you think, oh, I should know that, but I don't really, is really, really important from the get-go. So starting with, you know, that in mind, I think was really, really important. Sophia, did you want to say anything about your perspective on the partnership working?
Yeah, I think for us, definitely working in partnership with CPSR Mind has just meant that we've been able to feed in that grassroots knowledge from the local community. Just having worked with the Peterborough Muslim community for the last, 4 or 5 years, we've kind of built up a real kind of a network and a relationship with a lot of the mums in the local area. So we've been able to kind of feed a lot of the information that we've gathered over the years back to CPSR Mind to help inform that service. And the other thing that's come about is really that we brought some key community partners to the table. And again, that's based on the local knowledge of Muslim networks in Peterborough. And I think also there is a strength in people seeing that partnership between two well-known organisations. It just adds a lot more weight to the projects, and we think there's also a newfound respect for the work that we're trying to achieve together when people see that there are two well-known organisations and names that they recognise. I think for us, definitely one of the key things that we've been able to bring to this project has been the faith and cultural sensitivities, being able to be brought into consideration. So, small things that, people might not consider, such as the venues that we use, considerations about, other faith and cultural sensitivities, and then also sharing information about what works and what doesn't work so well, based on our own experiences of working with the local community. So, bringing in conversations that we've had with local mosques, for instance, and how proactive other organisations are, identifying which other organisations might be open to discussing mental health more openly, and, that we might be able to tap into. So those are just some of the key areas that we found have really strengthened this, working partnership together.
Yeah, and I think all of those things that Sophia has just outlined, we wouldn't have been able to access easily without that partnership approach. So I think that's starting with that really upfront to start off with. So we know there's research that already exists to say that women from Asian communities are disproportionately less likely to access local perinatal community mental health provision. So we'll go into that in a bit more detail about what we found locally about why that might be. We also know that Peterborough has a large Muslim community, so 9.4% of the population, but that was in 2011, so clearly it's grown since then. So we know that's a big part of our population that we weren't reaching. But what we found with our normal our kind of open offer to the community, 450 women accessed that since 2013, but only really small numbers from the Muslim community. So the big question was, why, and what can we do about that? And that was our starting point. So that was the context. And these were our project objectives, to explore the barriers that Muslim women face accessing professional support, and to identify ways of improving trust and engagement. That's so important at the heart of it, I think. To look at redesigning what was already existing, to bring into that faith-based content, and to make sure that we were able to deliver the programme by members of the community. I think that was a really important element. And then to develop the evidence and share good practice, which what we're doing today. We use the service design approach. So this is Mind's National Mind service design approach. I've got my little toolkit here, which I can show you. This is a great big book, and it's absolutely fantastic. It's one of our Bibles. So I suppose I'd say I'm not kind of part of the perinatal team. My background's organisational development, and I was part of the team that facilitated this service design approach. And I think it shows that actually in a project like this, you need different skill sets. You need that sort of service expertise, you need the community expertise, but you also need somebody who can maybe stand back and look at the wider service design piece. So we used the diamond approach, as we call it. So you have different phases through that service design, and particularly you see the explore one, which was where we you open up ideas and you try and hold yourself in a space where you don't try to come to conclusions conclusions too soon, or think that you know the answer too soon, that you allow your sort of mind and your curiosity to be, and to focus on what the voices of women and the communities and also professionals are telling you, and then you close it down into, right, okay, what we're going to do now. So a brief overview of the different parts of the service design approach that we use in Mind. So what did we do? Well, we started off with recruiting people from our community, and we recruited 8 peer designers and 4 project workers, and the project workers are still with us. They're delivering the service, but the peer designers were with us for a period of probably a couple of months. We did various different workshops with them, and we wanted to ensure that we had a wide range of backgrounds and ethnicities and experiences and age, and that, you know, not to sort of think of our Muslim community as just one homogenous group. They're not. They have all, you know, different kind of starting points, different backgrounds, different experiences and relationships with the community and their wider families. So we wanted to get that mix in. We were absolutely blown over by the interest that we received in all of these posts. Actually, we had such a volume of inquiries and interest. We held a kind of like drop-in day where we could talk more about what we wanted to achieve and what the posts were about. And so that was really encouraging in terms of engagement initially. And so we ended up with 8 peer designers who were paid posts, recognising people's time and value and experience, and, you know, we worked with them to open up the ideas, look at the issues, and then one of the workshops was about teaching them how to do ethnographic research, which was, again, as part of the Minds service design toolkit. So we're equipping them with skills to go out there into the community to do ethnographic research, which they went away and did. And meanwhile, our project workers did some desktop research and talked to other local health professionals. We came back and had a very, I suppose, emotional, powerful listening circle workshop where we heard the stories of the women, and they were incredible. We were very privileged, I think, to hear those voices, and hear some of the really difficult stories that people shared with our peer designers. So we took those stories and really looked at then what are the insights that we could look at. So we were able to talk to 24 Muslim mums. So each peer designer had talked about 3 people, 3 mums, and we focused on what's important to people, you know, what impacts on their well-being, the day-to-day lives of people, what's important to them, their hopes and aspirations for themselves and their families, and looking at their experience of mental health during that perinatal period. So it's really about, I suppose, walking alongside somebody in their life and asking open questions, not going along with a kind of solution in mind. It's really about hearing that voice, as I've said. And yeah, this is what we found. Sophia, I'm going to hand over to you now to talk about what we actually found.
Thank you, Kate. So as Kate's explained, obviously we went into quite a lot of depth and detail when we interviewed these women in the community, and some of the key themes that came out, some of the key insights that we took forward. So one of the main ones was loneliness and isolation. We recognise that, you know, loneliness and isolation is something that, you know, it's an issue across the board, but especially with the women that we interviewed, a lot of them identified some of the experiences from within their own families, some of the lack of support that they might have had from within their own community, from their own family, again, from their own husbands. And again, this isn't to sort of generalize, you know, it's kind of a snapshot of what we heard from the women that we spoke to. Sometimes we found also that, you know, that there was a bit of a trust issue within the community, and that was a bit of a barrier to seeking support from other people in the community. And then also sometimes the location of services, that can also have an impact on accessing support and services. This was identified as quite a big barrier, actually, especially because some of the women we spoke to weren't actually car drivers. And then language and terminology. So some of the mums don't understand what's being talked about often, and this was a key thing. It wasn't just about the the language itself in terms of the English, but it was about, you know, how mental health is talked about in general. And if there is a stigma attached to that sort of language and terminology, then I think it's you know, it's understandable that some women may just switch off or feel that it's not really for them. And then coming back to the what's in the slide about self-care. So actually, this was a major one, because I think more than half of the women felt that they didn't have enough time or space for self-care. And that then had quite a big impact on their confidence, their self-esteem, which meant they weren't able to go out and access the services that might have been on offer for them. And then touching upon some of the others, some of the mums felt completely unprepared for motherhood. This is something, again, we don't talk about enough, and it was really refreshing to be able to hear the mums talking quite openly about that particular barrier. And then stigma, again, there was a recurring theme of stigma that came out in lots of the conversations that we had. It was not just the level of stigma within the community, but just also some of the mums experienced perhaps racism or discrimination from in the community within the services that they were accessing, which meant that there was that added layer of you know, I don't know who to go to, I'm not feeling understood at home, but I'm also not feeling understood by the services that I'm accessing. So there's that kind of, you know, double level kind of stigma. So I think those are the kind of main themes that came out that I wanted to focus on. I don't know if there's anything else, Kate, that I've missed out that's worth mentioning.
I mean, we found a lot, didn't we? And it's almost like you have to, our insight report, which we can share the link of in the chat, it sets out all the things we did find. So as that diamond, we went quite wide, and there were lots of things that people were experiencing when we were experiencing that was just about being a member of the Muslim community in Peterborough, let alone being a new mum. And I think we had to work quite carefully to hear that, but also to recognise what was in the scope of this particular project, and that's where we come to the how can we statements, isn't it, Safira?
Yeah, so we started to look at, sorry, I'm just going to bring up my screen again, I've lost it. So we started to look at some of the themes and how we might be able to, sorry, one second.
We were able to, in our insight report, sort of really highlight the insights that we'd seen by the key quotes from the interviewees, and then we sort of looked at things like how can we, so for instance, where we were finding things like a theme around maybe husbands not understanding, you know, or thinking that the mother needed to do lots of housework as well as look after the child. Instead of looking how can we change the husband, it was like how can we empower that woman, how can we help her to think about her needs and self-care. So we had to really think hard about what this project was intended to support, who it was intended to support, I suppose. Safira, are you okay there?
Yeah. Yes,
Yeah.
I'm okay. Yeah. So we started, as I said, we started to really think about the design of our workshops and courses. So really looking at the content and how it needs to be tailor-made and tweaked for the local community. So we started thinking about language and terminology. That was, you know, a big thing that came up. Also something as simple such as where the information about the courses is communicated and how. You know, this was something that came up as well, you know, that certain places that women wouldn't access, if we've got posters up there, are they likely to see them? Probably not. You know, how likely are they to attend? Probably not, because they haven't seen the information, it's not filtered down to them. And then again, even in the information that we're giving out, what sort of language and terminology we're using. So all of this we've been able to kind of look at and sort of embed into this service that we've started to roll out. And we've tried to ensure that the Connecting Muslims courses are, you know, accessible, not just in the ways that we've talked about physically, as well as from a community perspective. And then we've tried to draw on other resources as well, such as support from within some of the local mosques, some of the local organisations. We've tapped into coffee mornings that happen locally, children's centres, GP surgeries, other places that might be able to support us with getting the word out about the workshop and about the new service as well.
So now we're going to introduce you to Mumtaz, who is our project worker who's actually delivering both the pilot and the actual courses. Mumtaz.
Thanks, Kate. So as Kate's mentioned, I'm one of the perinatal project workers that was recruited to work on the Starting Well project that was launched last year. Now, as she's already said as well, that CPS Healthmind has been successfully offering free services to mums during the perinatal period for a number of years, such as wellbeing programs, support groups, and one-to-one sessions. Now, since the other project workers and I joined CPSL, we've been involved in working to develop that religiously and culturally appropriate version of the course to support Muslim mums who are experiencing relatively mild mental health challenges in the perinatal period, such as loneliness, isolation, and anxiety, as Sephora said. Now, following the research that Kate spoke about and the evaluation that Sephora mentioned, we've redesigned the current Connecting Mums program to make it more relevant to Muslim mums, and we've called it Connecting Muslim Mums. So this course gives Muslim mums an opportunity to make connections and build support networks with mums of the same faith at similar situations that we hope will last a long time. It also offers a space in which the mums can discuss any feelings of low mood, anxiety, and the general struggles of motherhood. So it's essentially the same program as is offered to the wider community because most of the issues facing mums are universal. And it's based around the 5 ways to well-being, which are be active, take notice, give, keep learning, and connect. We still discuss the same theories such as the good enough mum theory, attachment theory, use breathing exercises, have a mother and child yoga session, and provide mums with a collection of tools and reminders to keep well. And the way in which we've adapted the program for Muslim mums is to link what we discuss back to Islamic teachings about motherhood and well-being from the Quran and also the teachings of our Holy Prophet, peace be upon him, while also being culturally sensitive. And we've also included Islamic meditations and reflections. So we piloted 2 courses towards the end of last year, and these were attended by 17 mums in total. One was online and one was face-to-face. And we got feedback via independent evaluators, which was overall very encouraging. And you can see the feedback that on your screens, and I won't read it out for you. So that was all passed to us, and alongside our own thoughts, as project workers, we made further changes and tweaks to the course. For example, we were told that the mums wanted less activities and more opportunities to talk. And also they wanted more wanted us to signpost them more to other organisations so they can get support from other places as well. And since the start of this year, we've delivered one course and we're halfway through delivering another. And the feedback from the mums attending these has been really positive. And the evaluations, like the questionnaires that we complete at the beginning, at the end of the course, has shown improvements in well-being across all areas, especially mental health and especially managing mental health, which is really, really encouraging. Obviously, those numbers are encouraging, but it's also nice to see and hear some of the feedback received on the course, which you can see on your screen. And I'll just read out one of them, which is, I loved meeting other mums and realizing that I'm not alone in how I feel. It's made me more confident in certain areas of life. And that's obviously really encouraging. It's also nice to personally see the positive changes in the mums attending. One mum from our current course that really stands out for me is a mum to 2 very young children, aged 2.5 and 6 months. Since the birth of her second daughter, she'd only left her house once before starting our course because of anxiety. But the course gave her a reason to come out and a safe space when she got there. And since attending, she's found a new confidence and has made connections with the other mums in the group, attended various coffee mornings at local mosques, and also our chai and chat group, which is based on the Good Mood cafes that Kate mentioned earlier. And she just looks more positive and happier. And actually, this week at our checkout, we check in and check out at the start and at the end of each session, just to find out how the mums are feeling, at the beginning, at the end. And she said she was hopeful. And that shows, it was really lovely to hear after only 4 sessions, the change in her since the start. So in addition to those Connecting Muslim Mums courses, we also offer one-to-one support to mums who aren't able to attend the courses for practical reasons such as childcare issues or travel arrangements, or also and also for those who have higher support needs because of anxiety, for example. We've also started delivering peer support groups for any of the mums that have accessed our services. So that's the Connecting Muslim Mums course or one-to-one support. And these are more informal drop-in sessions that are led by the mums. So they choose the topics they'd like to discuss and the activities they'd like to do, and we just facilitate that. There's obviously still work to be done, and we're now focusing our attentions more on promoting our services, and we've got a few things lined up. So hopefully these are going to enable us to spread the word, and so more Muslim mums know about and can benefit from our services that we have on offer. And that's me done. Thank you.
Thanks, Mumtaz.
Thank you so much, Kate, Mumtaz and Sephora, for that presentation. So interesting to hear about the work you've been doing and the learning, and that it's, you know, a continuous process. If anyone, I can see there's one question in the chat. If anyone has any further questions, please do post them in the chat, and as I said, we'll come back to them for the Q&A panel at the end. So I am so pleased to now hand over to Adrian from Lancashire Women for her presentation.
Thank you very much. Celeste, are you okay to share the slides? Brilliant, thank you. One step ahead of me. So thank you everyone for having me here. Just to introduce myself, I'm Adrian Mackay. I'm a team lead here at Lancashire Women. Lancashire Women is a charity based in Lancashire, and we've gone kind of within the last 30 years from being an organisation with kind of 6 employees to now having over 90. So we continue to grow and grow, which is amazing. We've also got a huge team of volunteers and that have kind of kept with us within the pandemic. And again, we continue to promote those volunteering opportunities. We have 3 centres within Lancashire. So we've got Burnley, Accrington and Blackpool, but we work in various outreach venues as well. So we are really very much across Lancashire. Next slide, please. So the Starting Well project for us has very much been a collaborative approach from the very inception of it. Kind of predating this funding, we worked within a local hospital in Burnley Hospital. There's a really small pot of funding that we had, and it just covered having 1 therapist in the NICU in Burnley Hospital for 1 day a week. Kind of from the outset of that, the support was just absolutely, you know, unbelievable, and the staff there were just asking for more and more support. So whilst we were based on the NICU, they asked if we could, you know, go into the rainbow clinics, could we go into antenatal wards? They just wanted more and more to support because they could see how beneficial it was to the mums in there. So this has really allowed us, the Starting Well Fund has really allowed us to extend on that offer. And I think something that we were very mindful of, being Lancashire Women, is that we are pan-Lancashire. And, you know, it didn't sit that we were just in one hospital in one locality. So we've really worked within kind of lots of different services to really be able to extend that offer. So we've worked with staff, so particularly in Burnley Hospital from the outset, but in the other hospitals in the area as well. So those in clinics, on the wards. We've worked with local NHS maternity services and within working groups as well to really create referral pathways to make sure that we're complementing the other services out there as well. We've worked with other external agencies, local authority, other third sector organisations, and also really capitalised on our internal connections as well. You know, we had last year over 8,000 women accessing our services, and we really wanted to make sure that we were, making sure that we had the right support for those already accessing our service as well. And we were really lucky to have the UCLan teams, the University of Central Lancashire team, come on board to do the evaluation of the project. So Laura McNally is on the call, who is part of that team as well. So we've worked with them just to really try and make sure that we've got the right support there. Yeah, next slide, please. Yeah, so the Starting Well project for us, I'm aware that, they're so varied and there's such a different amount of support out there. So the Starting Well project for us, as I said, really began within the NICU ward. We were able to extend it, and we had 3 different parts. So the first part is we are now in 3 local hospitals. So we're in Burnley, Preston and Blackpool hospitals within the NICU, so the neonatal wards, but also in the Rainbow and fetal medicine clinics there as well. And that's really for 4 days a week between the hospitals. So 1 therapist in each hospital. We are hoping to get into Lancaster soon as well, to make sure that we're kind of covering all the hospitals in the area. So as you can imagine, there's lots of different things that happen within the wards. So whether that's, you know, complications within pregnancy, whether that's loss, you know, any baby being in NICU. So the therapist will work, it's very much, you know, by the cot side, it's a very much ad hoc basis, what the parent wants at that time. And what it's also allowed us to do is work with not just the mums, but dads, partners, grandparents as well, whoever is being affected there. So the second part of the project is when we spoke to the staff on the ward, what they had said, so specifically with Burnley, it was a very specialised ward. So we were getting people who were accessing that ward from not only other places in Lancashire, but from Greater Manchester. There was so many different people that could access that. So, and it was really very much, we were kind of funded to work with the Burnley postcodes. So what we've done then is we created a community offer. So we work sometimes within the hospitals, sometimes within community outreach venues, within our centres, to offer that one-to-one therapy for the parents who require that. So it was really extending the offer. We were very much aware, and having spoken to a lot of the staff and also parents, that, you know, maybe within the hospital isn't the right time for them, and it might be 6 weeks, 6 months, a year later, when actually that's when they were wanting that therapeutic support. Yeah, next slide, please. So this is kind of where we started off within Starting Well, and these were our postcards. So I think initially it was quite difficult with the hospitals. We were very much within the pandemic and lots of different contracts. So it was quite difficult really to obviously get, you know, the marketing and reaching out and the networking together, but we were able to, and through the links with Burnley Hospital, that we were able to get there and get our therapists on the ward there. So this is kind of where we started. And yeah, next slide, please. So we tapped into all these different places to really, really cement the offer, to see, you know, to see how we could extend it and make sure we were offering the best support. So I think initially we started with the North West Neonatal Operation Delivery Network, which is a network, and it runs across kind of South Cumbria and Manchester as well. And it was specifically around that neonatal support. So it was really amazing to be able to speak to those other third sector organisations. And specifically there was Spoons Charity within Greater Manchester, which were just kind of ongoing with the report into neonatal care, and kind of what the parents were wanting, what that support would actually look like. And we were really able to use the report that they'd done to really inform our services on what we could take from that. And also as part of that operational network as well, we were able to see and share the best practice with each other. So they were looking for kind of that representative in each area. And that funding came to an end today, actually. So they developed like a peer support training package. So they were able to share resources with us, so that the peer supporters they had potentially in like the Blackpool area, the Preston area, that we could then continue to support those volunteers within the peer support. From that as well, there was some PAG groups that we were able to speak to, and we were really, really lucky to speak to some of the parents that sat on those groups. So right at the beginning, initially, we spoke to a group of mums, and they were just an amazing set of people to speak to. They were really, really transparent and honest and open with us. So it gave us the opportunity to speak about some of the marketing that we wanted to do, some of the terminology that we were using and what they would prefer. So it was a really amazing insight into what they wanted and what they thought that the support would look like, rather than us telling them what we were going to do. So one of the things that came out of that was we used Starting Well as kind of the name for the project, and they agreed that not all parents would want to say Starting Well, you know, it wasn't maybe appropriate for them. So we were able to then inform our marketing and rename some of it as the Family Wellbeing Service, dependent on where they would see that. So that was a really, really useful talk with them, and just really helped us inform the service. So just in terms of the NHS as well, kind of just sort of after the Starting Well project started for us, the Lancashire and South Cumbria Reproductive Trauma Service was in the very early stages. That was slightly similar support to what we were offering, but right from the very beginning we were able to work with them. My colleague Karen sat within their working groups, and we were able to work complementary. So whereas our service would really support those with mild to moderate mental health, they were then working with moderates as more severe. So it really ensured that we had that referral process there, and we had that pathway to make sure that, you know, there was consistency across the board. And again, as I mentioned with Lancaster Hospital, we initially struggled to get access there, whereas because, you know, within the NHS, they were really able to help us out. You know, we said that we weren't unfortunately working in Lancaster, so they've really been able to set that in motion now, because it was a service that they were offering there. They wanted to make sure that across the board there was consistency for all, you know, everyone accessing the support there. And from that, we had some absolutely amazing training, which was by the Institute of Health Visiting. And it was a perinatal mental health champion training, which was just unbelievable training, and one that kind of half the team undertook. And again, that was through them and really working with them to make sure that we were working complementary, and kind of as a wider team, as in perinatal mental health champions. There's, you know, plans that we will go out and deliver that as well where needed. So between NHS and third sector, and it was really amazing again to look at that good practice to see how we can inform our service there. We are part of the North West Coast Clinical Network again, so we get any kind of updates. If things have changed, again, if we've got a new group running, we can obviously send that information to them, and that will go to obviously the NHS staff within that network, which really means that the people who may need that support, you know, the staff can access that as well. The Maternity Voices Partnership, there's one kind of in every locality, and we attend those as well, which are really amazing. We get obviously parents with lived experiences that access them as well, but it means that then, you know, we can have a voice as well for some of the people that, you know, we're working with if they're not able to attend, and take some of the feedback that we receive there. And you know, it is an amazing group. And I know within the pandemic, I think Lancashire was one of, you know, the areas that kind of introduced having partners attending scans and things like that sooner. And I think that was, you know, very much something that sat with Maternity Voices Partnership, and really fighting to make sure that that happened again. So it's an amazing thing to be a part of. And again, it means that we can really make connections with staff that would sit there on the wards. And again, just to make sure that the support is getting to the right people. Recently, we're trying to develop the group offer. I think within the pandemic, it was quite difficult. We did trial some online groups, but we really wanted to get some face-to-face and that peer support happening. So we have recently had, you know, meetings with local authority teams, social prescribing as well. So, for example, within Blackburn with Darwin, there is a Move More, Eat Well initiative going on at the moment. So it was really great to speak with them. So with one of our groups that I'll speak about in a moment, it's very much about kind of mind fit, self-esteem and confidence. So it was really linked in well with something that they were doing with kind of yoga and Pilates. So it was about, you know, can we work together? Can we, you know, maybe do a taster session of something, or can we come and do a taster session with you? So it meant that we weren't, you know, conflicting. If there were things out there, we were trying to very much link up and make sure that there was that wraparound support for parents as well. Yeah, next slide, please. Yeah, And going back kind of to internally, we, as I said, we supported over 8,000 women last year. And these are just some of the things that we do. So within the community and wellbeing, that's where Starting Well sits, but we also have employment advice and guidance, money advice, and justice and safety clients. So it's really making sure that we speak to our colleagues as well, and to identify the gaps that we may have previously had, or gaps that people can identify, to see whether we can put that support in place. And that's really, really informed the groups that we've created going forward. Next slide, please. Yeah, so as I said, in terms of the group and peer support offer, that's very much kind of ongoing at the moment. We're really excited that we've kind of got 4 groups that are just about up and running. And it was very much about taking all these places, all the staff, all the, you know, the different organisations that we were speaking to see what gaps were needed, or, you know, what the staff on the ward said, what the parents said, you know, what the PAG groups were telling us. So it's really taking all that knowledge and trying to create some really very tailored groups, and maybe try and fill some of those gaps that we were seeing. Yeah, next slide, please. So from that, these are 4 of the groups that we've created. It is very much something that has been a real ongoing issue, and the therapists that will be delivering these are absolutely amazing. You know, we kind of did, as a team, went through the content for all the groups, and they are absolutely unbelievable. I'm completely in awe of you know, the content that's in them. So one of the things that very much came up from the neonatal staff was that a lot of the parents are very concerned about the attachment, and maybe that they feel like they've not bonded with baby because there's been so much trauma. So we have developed a group around baby bonding and attachment, and we're going to hopefully have a group setting up in Burnley very soon for that. And again, it's kind of tapping into some of the other groups that are out there as well, to make sure that we're not kind of, you know, stepping on toes as such, because there is other support out there, but to, you know, it could be an existing group that we go and deliver that to. The next group that we've got is the MindFit Mums group, which is very much about the peer support. So it is about confidence, self-esteem, but also looking at those things like sleep and relaxing and self-care, that again and again within the one-to-one therapy are common themes that come up. So it's kind of taking that, looking at that evaluation that we've done there, and really trying to inform the groups. So we are running a group which has started off very much as like a coffee morning, come and meet, you know, kind of come and meet the facilitator, and it's setting off now to go with the content. But we've made that quite an open-ended group. People don't have to come every week. It doesn't have to be that they sign up for 6 weeks. So it is a fantastic group, and that is doing really well. And again, that was something that we can do virtually as well as in person, you know, if people can't get out to the centres. One group that has come from actually internally within our justice and safety colleagues is the SKIES group, which is support, kindness, information, empathy and sharing. And that group is, you know, it is an amazing support. So within our justice and safety, with our justice and safety colleagues, so they work with a lot of women who may have been in prison, they may be at risk of reoffending, they may be prison leavers. And one of the big things that we find is that they have experienced loss of children through, you know, being removed by a local authority. The feedback that we've had is that there's no support. There's obviously a lot of stigma around that, and that they feel like they don't have a right to feel that they've lost anything. They can't go and sit with someone who has experienced bereavement because it's completely different. So really they're very, you know, they're very much worthless. Their feelings really don't account to much. And that was a lot of the feedback that we had within that. So that was a real gap that we thought, you know, that would be absolutely amazing if we can set something up to support them. And again, we've got a 6-week course that is going to start in May, and it looks at loss, boundaries, self-care and relationships there as well. And again, it's an amazing course, and I know we've already got quite a few women that have signed up to that. And again, another group that has come from some feedback from Preston Hospital actually, and it was the bereavement midwife team there, that they said that it was something that they really needed within that area, is to look at those who had experienced baby loss and get a peer support group there. So we have a Supporting You with Baby Loss group that runs at the moment. It's a 6-week group, but what we really hope will be, week 1 is the introduction, kind of weeks 2 to 5 are very much about the content and kind of looking at grief and loss and experience and living with grief. But then week 6 will be very much led by the attendees. So it might be that they decide that they're going to do a walk and a coffee, and that then can be a self-sustaining group, and that really can very much be a legacy. That we are very aware that the funding does run till March next year, so we really want to make sure that this peer support continues, and that if our facilitators weren't there, that the group could be a peer support. So it's not that we would kind of actively encourage that, but even after that first session, the ladies were kind of swapping numbers and things like that, and that's something that we're really, really keen that does happen. And then just finally, the next slide, please. So just as I mentioned, the University of Central Lancashire are doing the evaluation of the project, which is amazing, and something that we're really, really excited about, that this funding has allowed. That we can really see what works with the project, what we've got right, what we may have not got right, and what gaps there are. I think one of the big things that came up initially was that within the NICU wards, there was a lot of traumatic things, and the staff were really struggling, that often the staff needed support as well. It wasn't something that was within our remit, but it was good to identify that gap, and thankfully there is a service now that can provide support to the staff. So again, we work with Laura and her team, and it's very much about, they're going to conduct interviews with some of the clients that we work with. So again, across all services, for those people who may have just seen a therapist twice on the NICU wards, maybe those have access to one-to-one therapy, or those in a group as well. So that'll be something, it's not about waiting till the end of the project to say, oh, we've found this and this. But if something comes up and the improvements be made or something to be changed, it is very much about that kind of in-time feedback as well, so that we can kind of inform the service then and there. So that's me. There is another slide that says any questions, but I think we've got the questions later on. Thank you very much.
Thank you so much, Adrian. Again, just an amazing presentation, and lots of learning to be shared with the people on this call. It's really great as well to see how many different partners you're working with. So important. Brilliant. Well, if you have any more questions for Adrian or any of the other speakers, please continue to put those in the chat. And I'm now going to hand over to Sally for our final presentation.
Hi everyone. I'll wait till the presentation pops up, hopefully hope Celeste's got it there. Thanks. Yes, I'm Sally Etheridge. I'm from Leicester Mamas, and starting with Leicester. Next slide, please. Thanks, Celeste. Oh, yeah. 2 partner organisations, CFF, which is the Centre for Fun and Families, and us, Leicester Mamas. Next slide, please. Centre for Fun and Families are the lead organisation. We've been working in Leicester for many, many years, same as us. They are leading the Young Parents Programme. That's led by my colleague, Kate Harris, based on their Teen Parent Pathway work. And again, very much co-production work that they've done, and it's extended out to under 25s as a result of seeing what the local need is. Next slide, please. Leicester Mamas, we support families. We've been around for a long time. We are very much a grassroots organisation. We're a group of 8 directors, Seven of us are from Muslim background, from South Asian background, and I think 3 are single parents. One of us is a wheelchair user. So we're an organisation that have a real understanding of many of the challenges faced by the mothers that we support. We're a breastfeeding peer support programme, and I'm a lactation consultant. I started it in response to the local need I saw from Muslim mothers many years ago as a Leisure League leader in Leicester, taking telephone calls from mothers looking for breastfeeding support. We now offer support with any feeding issue. We're a women-led, mother-to-mother, evidence-based and specialist organisation, and that's our pathway. So we start at birth, during pregnancy, and we look at all these things going through. You may not be able to see all the labels, but looking at sleep, looking at bonding, looking at feeding support, and moving right on to going back to work, and then also offering training for mothers and increasing their skills and knowledge as well where they want it to. Thanks. Next slide, please. Starting with Leicester, the aims and outcomes that we had, and this is all, everything we do is co-production. That is how we work. Everything has always come from the women themselves, the mothers themselves, and it's from all different backgrounds, without a doubt. So these are the things that we have seen are the needs. And definitely starting with antenatal classes. I started our organisation because I went to a local community centre looking to see what we could set up to support new mums. They were offering antenatal classes, their community antenatal classes, that I still think are probably the longest running community antenatal classes in the country. They've been there for 30 years, and they were with an interpreter and very much aimed at local South Asian mothers who had come probably straight from India, straight to Leicester, without any family member with them, and really looking at their needs and supporting. And that's where all our understanding of what women need has come from and grown from. Okay, next slide, please. We are really well linked in with local organisations, statutory, community and voluntary organisations, with very well established partnerships. That's in the hospital, especially with all the infant feeding teams in the hospital and community. We are commissioned by the NHS Trust now. We weren't for many years, but we have been for the last 3 or 4 years to deliver breastfeeding support for all families across the city, with an emphasis on those with any vulnerabilities or those in higher deprivation areas. We also link with the speech and language and community strategy, and that came about from hearing that mothers that we support were worried about bringing their children up in a bilingual or a multilingual family and how to best support that, and so have developed links with that, the project lead for that. LNDS, the local dietetic service, we link very strongly with them. Wesley Hall Community Centre, a very large community centre based in the heart of Leicester, which I'm very closely connected with as well. And other national organisations, Durham Infancy and Sleep Centre, who work alongside the Lullaby Trust and Public Health with Safer Sleep, and First Steps Nutrition, and both those organisations, their leads have been patrons of mamas for very many years as well. Next slide, please. And Leicester. So Leicester is a city that I'm not sure how many people really know that much about Leicester, apart from possibly a bit about the football that we won a few years ago. And there's a picture of us actually celebrating that, a mural that was done when Leicester won the I don't even know what it is really, but some cup of some sort. That's all I know. But Leicester was the first city in the UK that was majority Black and minority ethnic. That means that we have many communities that do value breastfeeding. They come from cultures and countries and religions that really value breastfeeding, and that's passed down through the generations. And that means breastfeeding is not the contentious issue that it is in many other places, where maybe how you feed your baby polarizes families and mothers. We really don't find that, and that's so refreshing, and it makes everything much easier. But it doesn't mean that people don't have challenges. In fact, the more breastfeeding happens, the more different challenges people might face, and then the more information support they may need with that. We do have good breastfeeding rates. We have many mothers in our community, and when I'm talking about the mamas community, who are breastfeeding beyond a year, and breastfeeding into pregnancy and beyond too. And that links also with our UNICEF Baby Friendly accreditation that Mama supports both the hospital and the community with too. Next slide, please. So Leicester is a city that has high levels of health inequalities and higher poverty levels as well. That particularly hit the city during COVID. You may know that Leicester was in lockdown for about a year, whereas other places were moving in and out. And that also means that there are many different challenges that the women that are part of our community are facing all the time. Next slide, please. It's really important to remember that actually breastfeeding is a safety net against the worst effects of poverty and inequality. It goes a long way towards cancelling out those health differences, and that really informs the way and our rationale really for reaching out and supporting any mother wherever she might be to achieve her goals in how she feeds her baby. And for the vast majority of families in Leicester, they want their baby to be breastfed, and we're there alongside them for as long as they want to do that. Next slide, please. That doesn't mean that everybody does, and it doesn't mean that there are very clear things across the communities as well. We know from feedback from different studies, from the infant feeding survey, that's the last one was over 10 years ago now, that white British mothers are often looked on maybe as the ones who maybe don't want to breastfeed so much, especially from poor communities, but we know that's not true, and actually more and more mothers from all sectors want to breastfeed. It's also not true that just because someone comes from a culture where breastfeeding is valued, that they understand that that's important. Everybody is susceptible to the society they live in, and the UK is not a particularly breastfeeding friendly society still. Next slide, please. So some of the things that we do, antenatal course is our sort of like entry, if you like, into what we do. We do it on Zoom now. That we changed to Zoom very quickly when lockdown started. Part of the benefit of the way we work in Mamas is that we can respond very quickly and creatively and agilely, if you like, to what we want to do. The mothers who come into the antenatal courses will then get that ongoing one-to-one support. They're in a WhatsApp group with other mothers that are also in the same course as them. We continue to engage with them after the birth, and they continue to be part of our community. They can have home visits, they can loan breast pumps. We really focus on making sure we're there for them as long as they want to. Next slide, please. Our Mama's Baby and Me is our core postnatal programme. It's been running for over 10 years, again developed in conjunction with knowing what mothers need, with them talking to them, with them being part of our organisation. Everyone really in Mamas has come through as a mother and then has gone on to become a peer supporter, maybe a volunteer. We have WhatsApp groups. Baby and Me is in person. We have Zoom sessions, but it's also WhatsApp, and we have about 5 or 6 WhatsApp groups, very big ones, where women really are supporting each other. They're very, very non-judgmental, very supportive for mothers, however they're feeding. It's not a breastfeeding organisation, and it really is something I feel really proud of, our WhatsApp groups, because that is where everybody supports each other. I'm on there all day usually. Women will contact me one-to-one, they'll contact through the group, And it's 24-hour, you know, women can put a message on our WhatsApp group about what's going on with their baby in the middle of the night and somebody will respond. And that is so refreshing, so reassuring. You know, it's also very so culturally diverse that no matter what culture or religion you come from, there's many other people on there who will understand where you're coming from and who will be able to, you know, give their own perspective and make you feel less alone. Next slide, please. In response to what we saw in our groups, we realised that there's a need for further support around healthy eating. So we're looking at starting solids, supporting alongside that. We also have started something called In Mama's Kitchen, looking at family cooking on a budget, and Big Cook, Little Cook, which is done in conjunction with our local nutrition dietetic service. Next slide, please. Lots around supporting perinatal mental health, emotional health and wellbeing program, a rolling program. Telling Our Tales again came from feedback from parents, a journaling project. We do lots of baby massage because that is something that I think all mothers really do want, and if you know we can find that we can get those mums out who may be really unsure and uncertain about joining and coming to groups if we offer baby massage, because it's culturally appropriate, it brings mothers together, it helps them to bond with their babies. It really does make that big difference. And of course, we also signpost on to other more specialist perinatal mental health services where necessary. And we're doing a lot around infant mental health now as well. Thanks. Next slide, please. After lockdown, the link that we had with the antenatal classes I mentioned a few minutes ago, where in the community centre, of course, they stopped. That meant we weren't reaching the women in that community so much. And at the same time, many of you may remember media attention on that. There's a lot of we know that there's a lot of women who work in that textile industry who were basically going from the factory into the hospital to give birth, and we really felt that there was a need for something to support them. And so we've started a project in the community centre with two of our mama peer supporters as support workers who speak other languages, and that supports with even giving essential items. We will go out and give antenatal support in the hotels where some of the refugees are living, and just making sure that we support with as many things as we can. If you have the next slide, you'll see some of the feedback. So these are two of the ones who fed back from that. You know, whenever we feel we're not sure about something or not sure what the letters say, we phone mamas. Even when we had COVID, Nadia brought us food and paracetamol, and it's like my family has come to see me, because so many of these mums have got no one. You know, they may have also fled an abusive relationship. They have really no one they know in Leicester at all. So having somewhere you can go each week, some friendly faces and people who really care about you, just makes a massive difference to these people too. Yeah, thanks. Next slide, please. Breastfeeding support. We don't have any breastfeeding groups specifically. Our support is woven all through our activities at every stage in any way that we need to, and that includes support for those who want to stop breastfeeding later as well, as support if they're combination feeding. We have our breast pump loan scheme, which is free, and then we support mothers who want to go on to become mama ambassadors or peer supporters as well, developing their skills. Next slide, please. So just thinking about some of the outcomes then after our first full year of starting well. We've had about 1,200 registrations on all our courses. The initial results from our external evaluation shows that the key outcomes are better mental health and well-being, far less social isolation, and increased duration and exclusivity of breastfeeding. And I think being able to measure that specifically is really valuable, because it's very difficult to show that what you are doing is having an impact on breastfeeding, because of course really only the first 6 weeks data is collected by public health. So being able to show how much of a difference that makes in the communities where, you know, this is one thing that will make a really big difference to the health of them and their baby too. And there's been a much higher profile as an outcome of the Starting Well project across the whole trust. They've started to understand what the first 1,001 critical days is about. You know, we've known that in Mamas for many, many years, but you don't always hear about the first 1,000 days. And when they had a launch recently of the first 1,001 days event for Leicester, Leicestershire and Rutland, we were consulted. We had some of them mothers in our group who fed back to one of the organisers of the event, and that was included then as a key presentation of part of that. We've also, as an outcome, had more funding from the CCG, which is amazing, and that will be to increase breastfeeding rates in particularly in areas of low uptake, and that is some of the poorer white areas maybe. And lots of engagement from many places, because we access so many mothers from so many different ethnic communities, and particularly from the South Asian community, you know, that we're completely embedded in those communities, that people will come and ask us for feedback and for really getting some key public health messages out there, particularly things around oral health and childhood immunisation and the COVID vaccine, which are known to be have poorer outcomes in particular communities. Next slide. So just some last feedback from some mums in our group, that they really feel that this is something they love. You know, these are the WhatsApp groups that they the mothers to connect with specialist support, to feel that they can get information about particular areas, that they're not being isolated, that they just can keep on going, and that confidence and reassurance that comes along with that as well. And feeling that, you know, what's out there on social media, when they come back and they say, you know, am I doing it right? I feel like rubbish, you know, I keep hearing these, you know, what about these wake windows? What about, should I be letting my baby fall asleep in my arms when they're feeding? And having so many people saying, yes, you are doing it right, is really, really what they need. And just to finish with the last slide, which will show you some images from our mums and our groups, lots of things there. So advocating with politicians, making sure that we're out and about, that we're doing all those different things to support all the mothers wherever they are in Leicester. Thank you.
Thank you so much, Sally. As a couple of people have said in the chat, amazing range of initiatives and services, and I really like the WhatsApp group too. Great, so thanks so much to everyone who have been posting questions in the chat, really appreciate it. So first question for all of our panelists, which is a great one. In your opinion, what are the 3 most important things for co-production? Should we start with Kate, Mumtaz and Sephora, if you have any thoughts on that?
I think Sephora's already put some stuff in the chat, haven't you?
I did sort of try to answer it, and it was quite a tough one, because I think there were so many key considerations, but I think definitely that the partnership work that we've had, I think certainly having that sort of equal partnership where, you know, we're able to make decisions together and have that influence in the community, I think has been quite important, because it means then that, you know, the community are taking both organisations seriously, and the work that we do is seen as equal. And I think also just knowing what resources you have between you and then being able to utilise them to maximum effect, really. I think that's been quite key for us. I suppose it might vary for different organisations, but certainly I think those have been the main ones for us. I don't know if you'd agree with that, Kate and Mumtaz.
Yeah, I mean, I think there's also something about, you know, not starting with the solutions. I think somebody else put that in the chat as well. It's about kind of really holding yourself about what are the right questions, not even what the right solutions are. What are the right questions is really important. But I also think it's about being really honest about what's in your kind of gift change. So some of the really big societal issues that came up when we were talking to the mums were, you know, it was really important to hear their voice and to listen, and to feel quite shocked actually by some of the things that people were saying about their experience with things like the prevent agenda. And, you know, that was a really hard conversation, wasn't it, Sophia? Do you remember? But also to acknowledge, well, what can we, you know, we can learn about that, we can bring that into our conversations with others, but actually we've got a limit to what we can change about that. And I think being honest about that is really important to build relationships and trust, and not to try and set out to do things you can't do. I think that's really important.
Really important points, thank you. Adrian, do you have any thoughts on that question?
Yeah, I think for us it's been really transparent, been really honest, and maybe having some of those difficult conversations sometimes. And, you know, especially if there's, you know, if there's other support in the community that could be potentially, you know, similar to yours, it's about how do we work together and make sure that it complements, and it's very much about the individual who needs the support. So it's not a competition, it's very much, let's be transparent, this is what we're, you know, this is kind of what we're thinking, what are you, it's having those very honest conversations.
Thank you. Sally, any thoughts?
I'm sorry, Celeste, I've missed the beginning question because I was just trying to, yeah,
absolutely. It was, what are the 3 most important things for co-production in your opinion?
I think it really is about being part of your community, absolutely being embedded in the community and being open at all in every way you can. I think that, and then also having those links with statutory organisations and joining as many of those, you know, the strategy areas that you can, and being part of wherever possible. You know, it takes a lot of time. But yeah, really, that is a key part.
Thank you so much, everyone. And I know some of the questions have been answered in the chat, but just for the benefit of people watching the recording, I might ask some of them again. So Mumtaz, Kate and Sephora, was there anything you wanted to add on the way the peer designers and project leads work and the kind of training they've had?
Right, so I'll kind of start with that, I guess. So the peer designers were this was all online that we did everything, by the way, because it was right in the middle of lockdown and pandemic and everything. So we took them through the kind of a 5-step workshop, one of which was about teaching them about ethnographic research. And when I say that, that's kind of, I suppose, a light ethnographic research. It's not, you know, it's not like spending a year with a family, but what we can take from the service design toolkit is that they've got a certain way of looking at that, of sort of, it's a deep dive into somebody's aspirations and wants and needs and experiences that allows you then to go through a process where you then look at what you're hearing, what you're noticing, and what sort of repeated things. And so we just developed a workshop that trained them up in that. And actually it was using the tools. It wasn't, you know, it was about, are you a good listener? Don't go with your own preconceived ideas of what that person's going to tell you, or what you think they need to be doing. So it's holding yourself in that space, I think. So that was the workshop we delivered, and then off they went and did the research, and then they came back with the kind of the findings from that. So I guess we were looking for people who, we were recruiting, it was very much about making sure people were comfortable with talking to people, with gathering information, with writing that down, with working in a group, and that's the things we were looking for. Yeah. Okay. So Farah, do you want to add to that?
Right. I think just to add to that, I think one thing that was key for us was that the peer designers all had that lived experience or perinatal mental health experiences, you know, so they'd either been through it themselves or they'd supported someone close to them, which I think really you know, without sort of clouding or kind of, you know, kind of clouding over what, you know, their judgments. I think it helped them to really have an insight into what questions they needed to ask these women and what answers they needed to be open to hearing. I think that's something that was a key consideration in our recruitment, wasn't it?
We also had to make sure that they were equipped with information about support afterwards, because if you're asking somebody to open up and tell their story, which could and often was difficult, traumatic, that you had to make sure that you were able to hold them as well afterwards, I think, and so we had to think, did have to think about that, and that was did we do it well enough? I think that's a learning for us. We you know, and I think also doing thinking about where you're going to do these interviews, bearing in mind that the women had children, and so you know, was it right to do it in the house, or was it right to do it in a park? Was it, you know, how could you do it safely and you know, still sort of have social distancing, etc., etc., etc. So it was complex, and we learned along the way. I'm not saying I don't think we got everything right all the time, but you know, I think the intent, what we found was that it was such a powerful space, and the intent and the relationships that we were able to build with the peer designers and then with the women, well, it was just something I'll never ever forget. I don't think it was just such a great experience.
I'd just add that, you know, as well as asking the right questions, the peer designers were like so good that they were just, ladies volunteered things to them as well, because sometimes we don't know what we don't know, so we don't know what questions to ask, but they volunteered things even though they weren't asked directly. And yeah, like you were saying, you know, supporting them afterwards, because one of the ladies I remember said that one of the peer designers said she spoke to a lady who hadn't spoken about her issues for 20 years. No one had asked her, and she'd never volunteered it. So yeah, it kind of brought things up that she hadn't been able to speak about for a while. So that support afterwards was really important.
Amazing, thank you so much. We've come to the end of the time for the webinar. I know there are lots of other questions in the chat, so we will pass them on to the speakers, and if they have time, they might produce a written response that we can share with all the attendees. But a big thank you to Emily, Dee and Rosie from the Department of Health, Kate, Mumtaz and Sephora, Adrian and Sally for your presentations. Thank you all of you for attending and posting in the chat. Really appreciate it. I'm going to post a very quick 5-question evaluation form in the chat. If we'd be so grateful if you could complete that, so that we can you know, improve in future webinars. And as I said earlier, we'll pop the webinar recording and slides online and send that round to you as well. But yeah, thank you so much, everyone.